Good evening and welcome to yet another episode of the Health and Wellness Show. Kama kawaida, this is where we inform you, we empower you, and we inspire you to take full control of your health and live your best life. My name is Chebet Birir, and today we are talking about gender-based violence, an issue that affects most of us, if not all of us. As we speak, statistics show that more than 130 women were killed between January and March this year, 2025. So those numbers are very high, and you can imagine these are reported numbers. We have a lot of cases that go unreported, and so it is very important to talk about GBV and how to handle it. Karibuni sana to the show. On set with me, I have Sarah Dafala, who is a case manager for gender-based violence cases. Most of the time, she deals with these cases. Karibu sana, Sarah, to the show, and thank you for the good work that you are doing. She's also an advocate against gender-based violence, and thank you so much for advocating against that vice. Yeah, Karibu to the show. Next to Sarah, we have Alberta Wambua, who is the director for the Gender Violence Recovery Center in Kenya. And she's also doing a good job advocating against violence and helping victims and survivors of violence overcome. Karibu sana to the show. Last but most important, we have Fiona Anyango, who is a survivor of gender-based violence. Thank you so much for making time to come on the show. Now, I want us to start with your experience, Fiona. First, I'm really sorry that you had to go through violence, and I'm grateful and I'm glad that you overcame and you're here to talk about it. So tell us, how was your experience? How did it start?
Okay. Thank you, Barry. I'm Fiona, here in Kenya. Okay, for me, nitasema haijakuwa rahisi kwangu. Imekuwa ni journey refu, but all in all, nimetoka out of it. Here I am.
Here you are. We thank God.
Yeah.
Yes. So
kuna wengine kama mimi sahi wako. Yeah, so I'm proud of it.
Thank you.
Yeah.
So unaweza sema ilianza lini kwanza?
Okay.
Na ilianza aje?
Okay, so mimi kukuja kwangu Nairobi tulikuja kuhustle, kutafuta kazi, kufanya kazi moja mbili, juko na watoto. As a human being, utafall in love na mtu bila kumjua tabia zake, ako aje nini. So that's how it's happened. So sikujua mtu tabia yake iko aje, like mtu hawezi jua tabia yake kwa sura yake kabla ile hujakaa naye for long. So tukakaa kidogo, tulianza kama urafiki. Kaona let me try this marriage. Nione kama ita work. So, si ati utry,
nyumbani
fall.
Nyumbani ni wapi?
Mimi
Ndio kuja Nairobi, ulitoka wapi?
Mimi nimezaliwa Mombasa.
Mombasa.
Nimelelewa Mombasa. In a slums called Bangladesh. Yeah.
Okay. So umekuja Nairobi, ukakutana na mtu,
yeah,
ukampenda.
Yeah, nimekuja Nairobi tu,
ukaingia kwa ndoa.
Yeah, tukaanza ndoa. Nimekuja na watoto wangu already. I'm a mother of two, by the way.
Okay.
Yeah. So tukaanza maisha, tukakaa kama kawaida. Mimi ni mwanamke wa kuhustle. Yeah, lazima utafute huku, fanye huku. But this person anatumia hizi, like tuseme hizi mira nini. Sasa hizi vitu mtu anatumia na we ujui. Unaona? Yeye ameficha tu. Sasa yeye anatumia, we ujui. Huyu mtu pia analewa. Kulewa ni kitu mtu anafanya, but kuna wengi wanalewa but hawako hiyo violent sana. So ilifika time tumeanza tu kidogo kidogo, like umelete tu job. Uko wapi? Unaona simu kama hizo. Niko kwa njia, mpaka ile hata ulikuwa unafanya kitu unawacha uko in hurry. So sikujua kama ni kitu itakuja ikuwe serious to the extent mpaka ni move out. Unaona? Ni kitu ilienda, ikaenda, tukao tunakwaruzana kidogo, mara kofi. Unasema tu hiyo ni mambo ya kawaida, ni ndoa, unaachana nayo.
Okay.
Yeah.
So unaweza sema alianza lini, kwa sababu mkipendana
like 2023. Yeah, 2023.
So alianza aje? Alikuwa anakuja nyumbani?
No, like ile umemuomba like pesa. Unajua sisi wanawake kama una kitu unafanya, hapo ndo sasa shida inatokea. Juu itakuforce uombe do, ujisaidie nao kwa nyumba. Mtu namuomba ile mkipatana maybe atakuwa nakupea. Sasa ile umehama umemove in kwake, uanze kuomba do, kutakuwa na some excuse. Unaona? Alafu ile wewe pia labda umeenda kwa hustle, my issues pia zitakuwa mingi. Umechelewa, uko wapi? Hapo sasa ndio inatokea. Wewe sasa hiyo labda hajakupea pesa, unampata maybe ako club na mtu. Obviously uko na friends pale kwa society wanajua huyu ni mtu wa fulani.
Wanakuambia.
Sasa unaona ukienda pale like umeenda kumwangalia like tuseme hujakula, huyu mtu hataki labda hata uende job. Jua anajua labda ukienda job anafikiria vitu zingine. Unajua unapigwa hapo. Sasa upigwe ile yenye utafanya hapa nitapigwa nikufe. Mtu aanzi hivyo. Anakupiga tu kidogo. Hiyo story inakuja inaisha. Next inakuja. Sasa inakuja to me ilikuwa ikakuwa kama mazoea. Sikukuwa na ile akilikuwa naweza move out nikae nifanye nini? Niliona ata change. Unaona, niliona si kitu anafanya kila siku. Ni kitu anafanya once itafika mahali atafanya nini? Ata change. So the biggest problem nilifanya ni kumove kwa nyumba yangu na kwenda kwa nyumba yake. Hapo ndio sasa alileta ile true color yake yote. Unaona? Sasa siwezi enda job, siwezi fanya anything. Ni yeye namwangalia. At the same time yeye namwangalia ni ile like kwa nini unaniambia? Unaona? Mwanamke ni mzuri na pesa yake. Hiyo ni kitu nililani ya kwanza. Kitu ya pili nikakuja nikalani. Sasa singekuwa naongea na wewe hapa. Mimi I was just rescued with some neighbors. Kama nimecollapse, sijui mali niko. Ilikuwa mbaya.
Pole sana about that. Tutaendelea utueleze the story more. But Sarah, please tell us, you manage these cases almost on a day. How many cases do you encounter? Kwa sababu tumesema between January and March, 130 women reported cases were killed. Theater violence, like killed. It went to the extremes. So how many cases do you encounter, say, in a day or two?
Thank you so much, Siabet. And I'll say also thank you for inviting me because for sure si rahisi. I'm called Sarah Dafala. I come from a group called Feminists for Peace, Rights and Justice Center. We are located in Kibra and our offices is in Olympic. Every day, the minimum cases that we get is 3.
3?
Yes. But there are cases that you get, like domestic. Someone has been beaten, like just the way Fiona said. Beaten, as you still navigate on how to do it, they negotiate, they reconcile, they go back. But there are cases that when it comes to my attention, I also don't take it lightly. It's either I take the survivor away from that place immediately so that I prevent any negotiation or any corruption that will happen in that. So every day I get 3 cases at least. Yes.
Okay. Thank you, Sarah, for the good job that you're doing. Now there's getting the cases and there's reporting. Wambua, you are at the Gender Recovery Center. We have, like say, she said 3 cases in a day, at least. That's about 3 times 7, 21 cases in a week. But how many cases reach the recovery center?
So thank you, Chebet, and thank you for having me. So at the Gender Violence Recovery Center, where we are based in 8 hospitals, we receive many cases and there are patterns to it and trends to it. So let me talk about, for example, 2024 April to March 2024 to March 2025, because then that's our annual year.
Okay.
We received a total of 3,455 cases. And out of this, 113 were teenage pregnancies. And 90% of them were children. So I can continue to break that down for you. Between April and September this year, we had a total of 1,448 cases. And 48 of them were teenage pregnancies. I'd like to also mention that this is all forms of gender-based violence, but mostly the form of violence that we receive at the center would be 76% sexual violence.
Sexual violence.
Sexual violence cases.
Okay.
What I'd also like to add is that, there, as mentioned earlier, there are different patterns. So, for example, now schools are closed. They're actually closed already for 2 months. We're going to have an upsurge of child sexual abuse. And then towards around the festive season, around December and all that, we're going to have more domestic violence cases. Things like, for example, as you mentioned earlier, you talked about femicide. So there are also two new trends that we are seeing. One is the femicide cases. You talked about the 129 since January and February just this year. And you rightfully said that a lot of them are not reported. When we listen to Fiona, and thank you for being brave to share your story, is that from those femicide cases, 50% of them have a connection to domestic violence cases. So they are connected to domestic violence cases, and they're also then, we'll speak more maybe later, that there are also challenges in why then this is not also being addressed. We also have another trend of gender-based violence called technologically facilitated gender-based violence, you know, the online one.
Yes.
But we also always forget that apart from just the online instances, there are other consequences after that. So those are the two, I'd say, forms of violence. Depending again on cultural practices or where it is, you'll have, for example, child marriages, you'll have female genital mutilation, depending on the cultural seasons of different times, yes.
Okay, and thank you so much for coming to speak about it. It's important that we get an insight into the numbers, so then that we know how the situation really is on the ground. But I'd like us now to talk about the experience that victims or survivors of GBV go through. Now in Fiona's case, hebu tueleze, wewe ulimove in ukiwa una trust huyo mtu.
Yes.
Na unajua uko na watoto wawili, uliingia kwa ndoa na watoto wawili.
Yes.
First of all, how was it kwa hiyo environment na watoto wako aje saa hizi?
Okay. Okay. So, watoto wako poa saa hizi, but kwa relationship kama hiyo, huwa inafanya wale watoto wako wana grow na kitu kwa mind yao.
Yes.
Unaona, wanaona vile unachapwa, vile unatritiwa. Sometimes labda mtu wako tu na pesa. Unaona pale pia. Unajua samadha ukifeel hauna pesa na unakaa kwa mtu. Sisi wanawake tunakuanga na hiyo mbele ya mdomo. Lazima kidogo utaanza kurusha mdomo. Pesa nini na wewe unalewa, vitu kama hizo. So unapata tunatoka Kibera, nyumba zetu ni hizo tu ziko. Hii ndio sitting room, ndio bedroom, ndio. Hakuna venye utafukuza mtoto nje. Unajua mtoto anaona ile kitu. Wengi wao wasemangi. Wamama wanachapwa hapa nje, lakini waendi kuripoti. Waendi kusema, wanasema, alafu kuna hiki tunasemanga ati hiyo ni mambo ya ndoa. Hakunanga kitu ati mambo ya ndoa. Ati hata neighbor hizi kuja kusaidia ukichapwa. Hiyo mambo ya watu wawili. Hakunanga mambo ya watu wawili. Nimelearn. By that time sikuwa najua vitu kama hizo. Unaona tu kichapo hiyo ni yenu hapo kwa nyumba itaisha. Utakufa. Kwa sababu gani? Nimechapwa leo sijasema. Nimechapwa kesho sijasema. Next nimepigwa mimi by the kwanza 2022 wenye wanajua story yangu they know. 2022 2023 ulikuwa ukiniona leo na mask, kesho utaniona sina mask, niko na black eye. Kesho kutwa nimefura pua. Yaani hiyo ndo life nimekuwa. Unaona? Sasa kitu ilifanya mpaka nifike mpaka pale nasaidiwa. Ilikuwa hii vita imefika to the point sasa mimi pia nikichapwa pia mimi nataka sasa tupigane. Sasa si unakuwa na ile pia hasira unasema sasa huyu ananichapa ujidefense. Unaona? Ukifikia mali kama hapo just walk away.
Pole sana Fiona, and thank you again for kukuwa brave na kusema story yako. Itasaidia watu wengi sana huko nje. But nataka nikurudishe nyuma kidogo tu. Huyu mtu ambaye ulikuwa unamtrust, ni wapi ndo alichange? Like when did you notice ameanza kukuchapa?
Mimi nasema sijui vitu zingine zinakuanga pia kwa family ama pia kwa society. Tuseme unaishi na mtu uko na watoto wawili. Unajua mtu like tuseme umekaa like 2 years. Wajua uko na watoto wawili, uko na experience. Unajua nikizaa mwingine kama siko stable financial ama nini mtoto atapitia maisha ngumu. So lazima pia ukuwe stable, utafute kama ni kazi ujipange vizuri. Kama ni husband umekuwa naye umeamua unataka kuongeza mtoto mwingine, lazima uone ni husband ndakaa naye ataniangalia vizuri. Unaona? So unapata watu from outside anamwambia sasa unakaa na wewe na unalisha watoto wake na hakuna wako.
Na si wako.
Unaona? Uko kwa maulevi sasa penye wanapiga mastori. Unashinda umetoa pesa hapo na kuna wako wale ndo wanakula. Unaona vitu kama hizo. Sasa unaona huyo akitoka huko, hata kama ako nayo, inakuwa ngumu sana afanye nini? Akupatie. Alafu pia kuna hii mnashinda kelele, tuseme mnaishi plot. Mnapigana, mnashinda mmepigana. Unajua kwa society pia jina inaenda mbali. Alafu kuna wale wanasema si atoke, anangoja nini? Mtu anakuambia utoke, au una ile akili utatoka utaenda wapi?
Hata labda hauelewi what is going on.
Sasa hiyo una pesa, utatoka unaenda wapi?
Napenda vile umesema hapo. Kwa sababu nataka Sarah tueleze. Like we have many women who stay in abusive marriages and relationships. One maybe for the child, number two, or children. Unashindwa nitaenda wapi na watoto. But we'll talk about the effect on children. Number two would be, where am I going? Nitaenda wapi? Sina pesa, sina kazi, sina familia. Maybe they're orphaned. They don't have a home to go back to, you know. So how would you speak to that? Because I understand with the many cases and stories that I've interacted with, it is very difficult to come out of it. So how do you handle such cases?
Yes, it is not simple. One, to bring someone to... we don't make decision for people, but at least we take them through some trainings. And the moment an adult, that is a big person who has come, they fought with the husband, and for sure there is an emergency, like medically. So that person, we don't refer and we leave it at that. Remember, we are at the grassroots. So we understand the setup and maybe even why the conflict and the violence happened. So one, as civil society organizations, many have come out to support survivors. And by doing so, there are some that even take them through entrepreneurship trainings, and they even support them. So that's why even it was easy for me to come here with Fiona.
Fiona, yes.
Because Fiona is one of them in my own network, and we've supported her. So she has a very long story, because this thing has been happening on and off, and still she could not make that decision. Just like she has said, that she was looking at nikitoka watoto wangu, ama nikitoka nitaenda. So whenever she could come, talk to friends, and maybe even come to us and talk to us, then tomorrow, after you've talked to her, tomorrow you see her back to that relationship. For us, it was just, okay, she has gone back. We'll call for a training. We make sure she's part of that training.
Okay.
So with that, there are many, because we have a network of survivors in Kibra. So when they are there, they share their stories. And by so doing, there are some people who have overcome it by leaving that marriage and setting up a small business supported with other organizations. And they're doing well. And I'm happy to say this, that even Fiona, as we are talking now, she's one of the people who is mentoring others, because after being given training and a seed to start a business, for her, she has really worked hard. And even now, she's even employing other people in her business. So it was not easy all the same, but with those trainings, we say it is a step to make them make a decision. Yes.
So you keep doing the work.
Yes.
Because it's easier said than done. Kuambia mtu toka.
Si rahisi.
Yeah. So Alberta, at the Gender Violence Recovery Center, how does it work? Like, how do you identify a victim, survivor, and how do you help them overcome, of course, the physical, emotional, and mental trauma?
So thank you. So survivors walk in. We have different ways that they would come to the center.
Excuse me.
So survivors walk in. We have different ways that they would come to the center. We have a lot of our survivors would be walk-in survivors. So that means they'd walk into any of the Nairobi Women's Hospital, because then it's an integrated model. We also have survivors who would be referred. So I've just met Sarah, and she's told me how she refers a lot of clients to our centers. So that those ones then, through their awareness, through them knowing that this is where you can get services, that they would come. We also have a toll-free number at GVRC, and also have one at a national level. Interestingly, to let you know, Chebet, is that 2/3 of the survivors who come to GVRC are actually referred by the police. 2/3 of the total numbers that we have. We also get survivors from other county government hospitals who'd come to GVRC for specialized care. So, for example, a child has a trauma fistula and needs a pediatric surgeon, for example. So I was in Busia just a month or so back, and I met a lot of people who just told me, a survivor, as someone related to me is getting the treatment. So when they come to the hospital, which is open 24/7, is they would come and they would have a safe space to be able to see what brought them there. It's safe and it's easier because it's integrated. So you're walking into a hospital that's not labeled GBV center. That's what we found that works in this community. So you'd walk in and say, this and this is what has happened to me. A lot of times, sometimes it's an emergency, then you'll be rushed to the doctors. What we also do then at GVRC is that we continuously enhance capacities of the clinicians at the centers, because the pre-service training is very minimal. So they'll provide the medical treatment, which of course includes history taking, documentation, the tests that are done, psychological first aid, lots of tests, for example, to be able to get the prophylactic treatment. That's treatment then to prevent you from getting infections and diseases. And that's why we have a lot of campaigns and conversations that survivors should come immediately within 72 hours, do not shower, to be able to keep the evidence and so forth. One thing I would like to emphasize again at what we do at GVRC and what Sarah has also mentioned, it's not a one-off thing. So as a survivor who does not need, for example, extensive treatment, that will take about 6 months for medical treatment. So you'd come, you'd go, you come back after 1 month, after 6 weeks, and so forth, up to 6 months. The psychological bit of it, which is harder, would actually take about 1 month. That's one-on-one counseling sessions, but also group therapy sessions. And also sometimes you have psychosocial support that's within the family members, or the one who'd give you the psychosocial support, or, for support. So all this, I would like to mention that it's at no cost to the survivor, but a cost to GVRC. So we have to fundraise and make sure that we provide this treatment. As an inpatient, it will take way longer. It will take way longer because of the severity. Some of them will have to come for, what is it called? Medical treatment over and over, or surgeries over and over. Again, let me not choose Fiona as example, but some of the survivors, when they come, they're not able to go back because it's not a safe environment. Sometimes you even have children who've been abused and they're brought by their caregivers who've abused them. So we also have temporary shelter, and we also have shelters that we work with. Like for GVRC, we have 16 of them that we support, but there are shelters across the country that are mapped, and there are also challenges in that. We also have social assessments that we'll continuously do because people have different needs. Around COVID, for example, we had 208 teenage pregnancies, the youngest being 11 years. So how is that girl giving birth, for example? How does she go back to school? Issues around sexual reproductive health, even for that child. How do they even take care of that child and their children, things like that. So through those social assessments, then you're able to identify, do they need a children's home? Do they need legal aid? Because we also provide legal aid. Something very important, and to break the cycle of violence, and using again what Fiona and Sarah said, is the economic empowerment.
Economic empowerment.
Those are some of the reasons why the women will not leave the abusive relationship. And it's important to know that, yes, you'll give all the information, the sensitization, the training, but it's them to make the informed decision. But they need that support continuously. So economic empowerment has been one of the ways that we break, one of the ways, not all of them, that then you break the cycle of violence, and then the women and children, for example, are able to continue. In summary, that's what we do. But again, important to mention that we also have to be very big on prevention.
Yes. And I want to stop you there, because we'll talk about prevention after the break. But before prevention, we'll talk about the psychological trauma that you've said is the bigger part of healing. And Fiona will talk to us about it after the break. Do stay with us.